Hello students, welcome to this session. So from now onwards we will be having discussion on the topics. So first is hemoglobin. So sickling test is a screening test for the sickle cell anemia. So in that reagent used is sodium metabisulfite. So on a slide you have to take 1 drop of blood and 1 drop of freshly prepared 2%, that is 2 gram per dl sodium metabisulfite. Mix carefully so that there should not be air bubble, and then you have to seal the edges of the cover slip by nail polish or wax, and then keep it in a moist filter paper in a petri dish, and then you have to examine after 20 minutes and then after 2 hours and then after 24 hours. So the observation is, if the sickle cell anemia patient is there, the cells, that is red blood cells, they will change their shape to sickle cell, and then after 2 hours or 24 hours you can see by wet mount. The wet mount you can see under the microscope, that is low power, and then you can confirm under the high power. So the principle is this sodium metabisulfite acts as a reducing agent, so it decreases the oxygen concentration in the blood and in the slide, and which is kept in the petri dish, and then at the lower concentration of oxygen the red blood cells of sickle cell anemia will change its shape to the sickle shape, that is crescent shape, and then if the normal patient is there, then the shape is not changed. So if the shape is changed, then we can call that sickling test is positive, and then we can confirm by hemoglobin electrophoresis. Now in short, what is sickle cell anemia? So it is a hereditary disorder in which RBC contain abnormal hemoglobin, HbS, and then because of that RBC becomes rigid and give the sickle or crescent shape. So in HbS there is substitution of valine for glutamic acid in 6th position of the beta chain, and then under decreased oxygen tension, so normally at the high altitude this HbS is less soluble than HbA, that is normal the adult hemoglobin, and then which forces red cells to become rigid, sickle shape, and then they cause hemolysis, and because of that there is anemia in that patient. Now second is the solubility test. It is also screening test for the sickle cell anemia. So in that we have to do it by tube method. So reagent used is the sodium dithionate reagent, which is acting as a reducing agent. So in test tube you have to take sodium dithionate reagent freshly prepared, and then add blood sample, few drops, mix and wait for some time, and then see for turbidity. So turbidity you can see against the ruled paper holding against the test tubes, and then if linings are seen, that means it is negative, and if linings are not seen, then that means the solubility test is positive. So the principle, sodium dithionate acting as a reducing agent, which in the decreased concentration in blood, the red blood cells change their shape to the sickle shape, and then that HbAs is not soluble, and then it causes turbidity. The confirmatory test is hemoglobin electrophoresis. Now next investigation is fetal hemoglobin. So it is screening test for the thalassemia, that is HbF hemoglobin. So the principle is all hemoglobins except HbF are easily denatured by the alkali. So total hemoglobin is determined of an aliquot of the hemolysate by preparation with the cyanamide hemoglobin method without alkali treatment, and the second aliquot treated with alkali and followed by ammonium sulfate when filtered, and filtrate contains alkali resistant HbF, and the OD of that content is taken. So the first step is the hemolysate preparation, that we can do by taking blood in the test tube and then centrifuge for 10 minutes, remove plasma, then to that cell volume you have to add distilled water, shake and centrifuge for 20 minutes. So adjust hemoglobin to 10 gram%. So this is hemolysate. Then second step, cyanamide hemoglobin. So hemolysate 0.5 ml plus Drapkin reagent 9.5 ml. Mix, and then you will get that brown color solution of the cyanamide hemoglobin. Then in that you have to take 2 tubes, that is F and T tube. So that cyanamide hemoglobin which is prepared from the patient sample, so you have to take in that F tube 2.8 and in the T tube 1.4 ml. Then sodium hydroxide to F tube you have to add 0.2 ml, and to the T tube you don't have to add anything. Distilled water to the F tube nothing, and for the T, that is total tube, you have to add 1.6 ml. Then mix at the room temperature for 5 minutes. Then saturated ammonium sulfate 2 ml you have to add, and then filter in the Wattmann number 42. Then OD of the filtrate is taken. So F, the OD will be ODF, and then to the T you have to add you have to take 0.5 ml of filtrate and then add 4.5 ml of the Drapkin reagent, and then take the OD, that is OD of the T. And the calculation, percentage of hemoglobin AF is equal to OD of AF divided by OD of T, HBT, into 100 by 20. So the factor will be 5. So percentage hemoglobin AF is equal to OD of AF divided by OD of T into 5. So next investigation is lupus erythematosus cell, that is LE cell, and it is done for the, it is screening test for the diagnosis of SLE, that is systemic lupus erythematosus. So in that, in test tube you have to take 5 ml EDTA blood and then put glass beads, that is broken slide or cover slips, and then mix for the 30 minutes. Then incubate at the 37 degrees Celsius for 10 minutes. Then transfer it to the Winthrop tube and centrifuge for 30 minutes. So there will be buffy coat at the junction of cells and serum, then that is plasma, and then make smear from the buffy coat and stain it with the Leishman or field stain, and then see under oil immersion lens. So LE cell is the cell that is it containing LE body, that is pink homogeneous structure is seen inside the nucleated WBC. So the nucleus of that WBC goes to the periphery, and in the cell we can see pink color body, that is LE body, and the cell containing that LE body, that is called as LE cell. So this is done for the detection of the SLE, that is systemic lupus erythematosus. Now we will see the hinge body preparation. So hinge bodies are seen in wet mount preparation when supravital stain like crystal violet stain is used. So the stain enters the cells when they are in functional condition, and then stain red blood cells are detected by preparing wet mount or a smear. So specimen can be EDTA or double oxygenated blood. So in that, what is the procedure? So you have to take in test tube 5 drops of the blood and then add 10 drops of crystal violet and keep it for room temperature 15 minutes, and then 1 drop of the mixture take on a cover slip and slide, and then put cover slip and see under microscopy, or we can make smear and see under oil immersion lens. So the purple color dots seen at the periphery of the RBCs, they are called as hinge body, and the clinical significance of hinge body is drug induced hemolytic anemia. In that we can see that hinge bodies. Now we will see determination of G6PD, that is glucose 6-phosphate dehydrogenase. So G6PD present in red blood cells, that is hemolysate, acts on a glucose 6-phosphate and NADP, and NADPH is formed in the reaction, and then that reduces blue colored bromocresol blue into the colorless form. So the principle in short is the decolorization. So your first step is preparation of red cell hemolysate. So that can be done by adding 2.5 ml water and 50 microliter blood and keep it at 30 minutes at the room temperature. Then for the enzyme, so take 1 tube, add 1 ml of the hemolysate, 0.5 ml of the bromocresol blue and 2 ml of the liquid paraffin, and keep it at the 37 degrees Celsius, and observation 30 minutes after, and then 60 minutes, 90 minutes and 24 hours. So normally decolorization, that is conversion of blue color to the colorless, that is brown color solution, takes place within 30 minutes to 60 minutes. If it does at the 90 minutes, then it is seen in the carrier, and 24 hours it is the G6PD deficiency patient. So the principle is decolorization test. OFT is the determination of osmotic fragility test of the red blood cells, and it is screening test for the conditions like thalassemia or congenital spherocytosis. So osmotic fragility is the degree or proportion of hemolysis that occurs when sample of red blood cells are subjected to hypotonic solution, that is near to the water. So the clinically normally the cells, that is red blood cells, start to hemolyze at 0.45% of the sodium chloride. In congenital spherocytosis, the red cells are highly fragile and start to hemolyze at 0.55% of the sodium chloride solution, and thalassemic target cells are resistant, so they hemolyze below 0.3% of the sodium chloride concentration. So in the procedure, red blood cells are suspended in decreasing concentration of sodium chloride, that is now from 0.9 percentage to the 0 percentage, that is water, and then degree of hemolysis is measured in each tube by using photometer.
Now we will see procedure of bone marrow aspiration. So in that, first local anesthesia is given into the periosteum, or sedation or general anesthesia is given in children. Then clean the parts, like if you are taking for adults the body of the sternum, or for the child medial aspect of the tibia or iliac crest, then clean the parts with aseptic precaution with spirit and betadine. Then bone marrow aspiration needle is introduced into the bony cavity by to and fro movement. After cavity is penetrated, stylet is withdrawn and tightly fitting syringe is attached. Then brief and strong suction, you can take 2 ml of bone marrow tissue. Then films are prepared immediately by placing the aspirated material on glass side and sucking of the blood which is contaminated. Then air dry, and then films are fixed into the spirit or methyl alcohol, and then you can do staining of the smears by Leishman or Wright stain. So by Leishman or Wright stain, you have to add the stain for 5 minutes, then add buffer for 5 minutes, and then wash with water and dry it and see under high power and then oil immersion lens.
Now, first investigation is bleeding time, can be done by capillary method, and it is called as Duke's method. So in that 1 millimeter diameter incision is made on the earlobe or the finger of the patient, and the total time duration after the incision till the stoppage of the blood is recorded, and it is called bleeding time. And normally it is 1 to 4 minutes, and increase if it is more than 4 minutes. It is seen in thrombocytopenia when the platelet count is low than the normal range, that is 1.5 lakhs per cubic millimeter. And it can be seen in drugs or infection like dengue hemorrhagic fever, or it can be seen in P. plasmodium falciparum, malaria, and von Willebrand's disease. Second investigation is blood clotting time, can be done by capillary method and venous method, that is tube method. So in capillary method, you have to take, after the prick to the finger, you have to take blood in the capillary tube, and then after few minutes you have to start breaking that tube till you get the fibrin string between two ends of the capillary. That is capillary method. And second is the tube method. It is also called as Lee and White method. So in that, venous blood is collected in clean and dry test tube without anticoagulant, and then wait for some time to clot the blood. Put that tubes in the water bath, and the time required for clotting of the blood is called clotting time. Normally it is 4 to 9 minutes, and when the clotting time raised more than the 9 minutes, it is seen in clotting disorders or coagulation factor disorders. Now third investigation is prothrombin time. So in that, you have to take two test tubes labeled as T and C, that is test and control. So in that control, you have to take citrate plasma of normal control patient, that is 100 microliter. In T tube, you have to take the citrated plasma of the patient 100 microliter, and then to both tubes you have to add 100 microliter of thromboplastin reagent, and then calcium chloride 100 microliter, and then keep these tubes in the water bath. Start your stopwatch and keep for the clot formation, and the time noted after the clot formation. So normally it is 10 to 14 seconds. So next investigation is fourth one is partial thromboplastin time. So in that you have to take tube of and then zero point 0.2 ml of the brain extract or platelet substitute, and then 0.2 ml of citrated plasma, and then zero point 0.1 ml of the pre-warm calcium chloride, and then wait for the clot appears and note the time. So normally it is 60 to 80 seconds, and then increased PTT is seen in liver disease and stage 1 defect, that is and patient on oral anticoagulant like warfarin or vitamin K deficiency or hemophilia. Fifth investigation is APTT, that is activated partial thromboplastin time. So in that, in tube you have to take zero point 0.1 ml of the brain extract, zero point 0.1 ml of kaolin reagent, and zero point 0.2 ml of citrated plasma from the patient and incubate for 1 minute, and then add zero point 0.1 ml of the calcium chloride and start your stopwatch and see the clot formation and note the time. So normally it is 35 to 40 seconds, and increased APTT seen in liver disease, massive blood transfusion, administration of heparin or patient on oral anticoagulant, vitamin K deficiency, hemophilia, and it determines the stage 1 defect. Sixth investigation is TT, that is thrombin time. In that, take zero point 0.2 ml of plasma in test tube and then incubate at 37 degrees Celsius for 1 minute. Then add zero point 0.1 ml of thrombin and calcium chloride mixture and start stopwatch and see for the clot formation. And you can take control also for comparison. Normal value is 15 to 20 seconds, and increased thrombin time is seen in decrease in fibrinogen concentration, that is hypofibrinogenemia, presence of dysfunctional fibrinogen, or high concentration of the FDP, that is fibrinogen degradation products, and presence of heparin or patient is on heparin. These are my references from where I have taken my notes, and I hope you find this session very useful for your academics and for your future practice. Thank you so much.